All right.
Yeah.
Hi, everyone. I'm Claire Beskin, co-founder and CEO of Empallo. Recently, I drove around rural Florida, knocking on doors, seeing who would speak with me. I had a chance to ask them about whether their patients have access to cardiology care. And I learned the situation is dire. I spoke with primary care providers, practice managers, directors of nursing, who told me, for example, they get heart failure patients discharged from the hospital. The discharge note says they should see a cardiologist in 1 to 2 weeks, but that almost never happens because the nearest cardiologist is a 1 to 2 hour drive away and is booked solid for 3 months. Empallo is solving the cardiologist shortage with our Care Copilot. Our AI platform helps with cardiovascular monitoring and medication management. This enables nurse practitioners and nurses to provide more care previously done by cardiologists. This is a win-win where patients can get more access to quality care at lower costs. Cardiology is a big market. The US alone spends over $300 billion on cardiology each year. We're starting in heart failure, which is a $30 billion market. A few things you need to know about heart failure. Only half of patients survive 4 years after diagnosis, but it doesn't have to be this way. There is a proven effective therapy that exists today, and it's called guideline-directed medical therapy, or GDMT. When patients are on GDMT, we see mortality goes down by 70%, hospitalizations go down by 30%, and quality of life improves. It does all of these great things, and yet less than 10% of heart failure patients get onto GDMT. A driver of this is that it is time-intensive and complex to get patients onto GDMT. Best practice, described by the clinical guidelines published by the American College of Cardiology and the American Heart Association, is that after diagnosis, a patient should have a medication adjustment appointment every other week for 3 to 6 months until they achieve their optimal dose of guideline-directed medical therapy. The current healthcare system does not make those appointments available to the patients who need them. We just launched our first product, which is a virtual clinic that helps keep heart failure patients on track and out of the hospital. The new and improved heart failure patient journey looks something like this, where after a patient is diagnosed, that same week, they have a telehealth appointment with an Empallo cardiologist. After that, they have regular appointments with an Empallo nurse every other week for 3 to 6 months until they achieve stable meds. After that, they get ongoing care as needed. Each step of the virtual clinic is made more efficient and more effective with our Care Copilot for medication management and our AI platform, which screens risk and escalates care as needed. We're working with several health systems, including Maine Health and the VA, who are sharing large clinical data sets with us that we can use to improve and validate our platform. With the VA, we recently achieved all of our National Science Foundation SBIR grant phase 1 milestones. So we are now eligible to apply for over $1 million in non-dilutive phase 2 funding. Our business model starts fee for service. For example, we're in network with Medicare, so when we see a Medicare patient, we bill Medicare and get paid for it. It's a simple, proven way to get started. While we're in this fee-for-service phase, we'll generate data that shows that heart failure patients who get care with Empallo have better outcomes and cost the healthcare system $3,000 to $4,000 less per year on average. With this data in hand, we'll then pursue value-based care contracts. We have big plans. We're in the data collection phase where we just launched our virtual clinic this month. We're starting to see patients in Florida, Massachusetts, and Maine. We're also continuing to validate our platform with our design partners. Next, we will scale our clinic in partnership with risk-based provider organizations such as ACOs. And in the longer term, when our virtual clinic is at scale in heart failure, we'll expand to other cardiology conditions. We'll also have SaaS opportunities to license our platform to external clinics. I'll take a moment to introduce the rest of my team. My co-founder, Ray, did a PhD in computer science at MIT, where he focused on developing machine learning models in heart failure. Our medical director, Dr. Dana Weishar, is an advanced heart failure cardiologist who ran heart transplant cardiology at Kaiser Permanente, Northern California, for about 20 years before she joined Empallo. We're raising $2 million in 2025 to drive growth with heart failure patients and our provider partners. If you'd like to join our journey, please reach out.